the intersection of technology and treatment, with medtech now permeating the most marginalized of communities, with there now being devices that can continuously monitor your heart rate, for example. Is innovation keeping pace with the prevalence of this disease?
In fact, there are a lot of technologies which are being in consideration, like telemedicine. Right? For example, there's a company known as AR3, and I'm closely working with them. In fact, angioplasty, I'll come to that later as well. So, where the patient, for example, has a heart problem, and there's a device which patient can keep with him. It's like a small iPad, and they just get attached to that. And I can be in Mumbai, that patient can be in any rural area. At a very stretch, just on my mobile, I'll get what his heart rate is, what his blood pressure is, what his respiratory rate is, what his saturation levels are. So technology is fantastic. Especially people who have pacemakers or people who have heart failures, they are at the risk of developing sudden cardiac death and irregular rhythms. So these can be monitored. We do monitors, for example, patient comes with palpitations or syncope or giddiness. We do tests like 24-hour heart rate monitoring, but that's just for 24 hours. Patient might not have symptoms during that time. What happens when they are not wearing the monitor? So there are technologies available where you can remotely monitor the patient. That's one. Secondly, not available in India. In fact, it is available in Ahmedabad now. Talking about technology, now there's robotic angioplasty, right? Where a robot can do an angioplasty. For example, the patient is over there, I'm over here with a console, as if I'm playing a video game. I can just advance my wire, advance my stent without even being close to the patient. That's one. I might be in another room, and just via cloud, I'm doing an angioplasty. And I see the future, like, I can be here and the patient can be in one of the, rural centers, and I might be guiding the junior doctors from here to do angioplasty. So there's no limit to innovations that we can go for. If supported by the government, by the policies, then there's no dearth.